What is hyperparathyroidism? Hyperparathyroidism occurs when the parathyroid glands give off too high levels of parathyroid hormone, also known as the PTH. This directly affects the kidneys, causing them to increase reabsorption of calcium in the kidneys, and also causes an increased excretion of phosphorus. This can lead to hypercalcemia and hypophosphatemia. When there's too high levels of PTH, this causes bone reabsorption, decreased levels of osteoblastic, which is bone reproduction, and increased levels of osteoclastic, which is bone destruction. This causes calcium and phosphorus to enter the blood and reduce bone density. So what can cause hyperparathyroidism? The main cause of hyperparathyroidism is usually a tumor or a cancer on the parathyroid gland, but you could also see this happen from a congenital hyperplasia, neck trauma or radiation, a vitamin D deficiency, chronic kidney disease with hypocalcemia, and parathyroid hormone secreting carcinomas of the lungs, kidneys, or GI tract. When you're assessing a patient who might have hyperparathyroidism, you want to ask about any recent bone fractures, weight loss, arthritis, or psychological stress that they've been experiencing. You want to find out if they've had any recent radiation to their neck or have had any traumatic neck injuries. You'll also see these patients have some GI problems, including anorexia, nausea, vomiting, epigastric pain, constipation, and weight loss. You're also going to see in these patients if they have a chronic hyperparathyroidism and it's been going on for a long time, they may have waxy or polar skin. High levels of PTH can cause these patients to have kidney stones. And these patients are going to appear lethargic and fatigued, which may worsen as calcium levels increase. Once the calcium levels are over 12 milligrams, you may start to see psychosis, coma, and death in these patients. So some potential nursing diagnoses for patients with hyperparathyroidism. Impaired physical mobility related to decreased muscle tone. High risk for falls related to their confusion and weakness. They're also going to be at high risk for injury in general related to their weak bones. And you're going to see a decreased cardiac output related to decreased heart rate, which comes along with hyperparathyroidism. When planning care for these patients, your goals will be for the patient to remain free of falls during hospital stay. Patients' calcium and phosphorus levels will normalize by the end of the hospital stay. They will maintain their adequate muscle tone throughout the hospital stay. You don't want them getting too weak. And the patient's heart rate will normalize by the end of the hospital stay. So what do you do for these patients? How do you take care of them? Your main thing with these patients is to monitor and prevent injuries. They're going to be a high fall risk. You're going to make sure all those side rails are up. They're going to have the fall band around their wrist. They're going to have a sign on the door. And you're going to be making sure without a doubt they don't hurt themselves at all. For drugs, you want to give them a diuretic or hydration therapy. Lasix is a very common one because it increases kidney excretion of calcium. You also could give them Sensipar, which is a calcimetic. These bind to the calcium receptors and reduce PTH production and release. Oral phosphates can inhibit bone reabsorption and interfere with calcium absorption, which is what the kidneys do when they have hyperparathyroidism. They absorb calcium. And you only want to give phosphate through the IV if you really need to get the calcium levels down quickly. And you also want to monitor their cardiac functions and their intake and output every 2 hours. How are you going to evaluate if these patients are feeling better by the end of their stay? You will see that the patient's calcium levels and phosphate levels will normalized. You want to see that their heart rate and rhythm have normal. And you want to see that their behavior is going back to normal. They're no longer feeling lethargic. They don't feel confused anymore. That's what you want to see in these patients.